Hello, this is Katherine Marie, and you are listening to Long COVID Real Talk podcast. I'm going to drop 2 episodes the same day. The first episode, which I just recorded, is about weight management and what I've been trying to do for that. And the second episode, which is this episode, is about urinary symptoms that I've been having that are new, that I've never had before. Fun! So if you don't have urinary symptoms or you don't want to hear about mine, please feel free to skip this episode. If you are curious or if you've had urinary symptoms as well and you want to hear about it, great. Some of this is just for me to document, and some of it is to share just in case it helps somebody else. So let me try to get the timeline right. And this is the second time I'm recording this. I just had a phone call interrupt the first recording. So I was like, put on Do Not Disturb. So I was put on a medication by the chronic fatigue clinic for the arm and leg aching, and it worked pretty well. The one thing was that, this is embarrassing, but I was on a baby aspirin, and I didn't think it would be an issue because it's a baby aspirin, but I started peeing blood. And so I stopped the NSAID that was prescribed by the chronic fatigue clinic, and I stopped the baby aspirin. The reason I'd been taking the baby aspirin was just because I was worried about the hypercoagulability nature of long COVID, of people getting clots and stuff. But I figured if I was peeing blood, that was not my concern. So I stopped taking it. I went to the urgent care. They did a urinalysis and culture. They treated me for a UTI, or urinary tract infection, because I was symptomatic. I was peeing blood and I had lower abdominal pain, like aching, dull in the bladder area. And I was having urinary frequency, which means you have to pee a lot, like frequently, and urinary urgency, which means you feel like you have to pee all the time, even if you just peed. And for women who've been pregnant, you already know all about that because you experienced it probably in the first and third trimesters. But if you've had a UTI, you also probably have experienced it. So they started me on antibiotic, and the symptoms did improve. Then I had a follow-up with my primary care doctor about something else and mentioned this to him. And he said, oh, let's get another urinalysis just to see how things are going. Things were improving, but it still looked like my bladder looked like there was still signs of infection in there, but it seemed like it was clearing out and it was a lot better. So we decided that since the symptoms had been much more minimal than before and were getting better, that we were going to hold off on doing more antibiotics. The other thing that we were not sure about was whether I was having kidney stones, even though the type of pain didn't seem to fit. Blood in the urine, like frank blood in the urine, can occur from kidney stones. So he ordered a urology consult, and I did a follow-up urinalysis about a week later as well, and that showed like it was, again, clearing up, but not clear, So he ordered this one test, and I'm going to, again, preface this by saying, if you are grossed out by things easily, I would skip the rest of this episode or skip ahead to like a couple of minutes or something. But anyway, he had me save my urine for 24 hours. How that works is they give you this jug with like this much of an opening, and you're supposed to pee into it for 24 hours and then close the lid. And there's some sort of preservative or something in a little sponge in this jug. And it smells terrible. But you have to fill it and all of your pee for 24 hours goes into this jug. So then, this is also really gross. Okay, so then after it's been 24 hours, you have to close the lid and shake the container for 1 full minute. You have to time it. And it was really heavy. So my husband actually did it. And I was so embarrassed because I can barely lift a milk jug, So that was really embarrassing. Okay, so then after it's all mixed, then you pour it into two different cups that they give you. You put labels on the cups, then you put the lids on the cups, and then you put little stickers to close the lids. Then you put them in a little baggie that has a sponge in each baggie. And then you put those two things into a container that's like a cardboard box. And then you close the lid. And then there's a form that you had to write what day and time you started and then what day and time you ended. And you have to deliver it to the lab within a few hours of finishing. So for me, I did mine at 5:30 a.m. because my daughter gets up early usually, and so I just figured I'll make that the first thing. So then that way, the next day when it at 5:30 a.m. I can stop peeing in the jug. I have time to try to get all the stuff together for the lab, and then after I drop her off at school, then I can drop off the urine at the lab. So there's this requisition form that you have to turn in with the urine that you put in a bag with the cardboard box with the two urine samples in it that are enclosed in the box at this point. And then you are supposed to pour the rest of the urine down the toilet. And then you're supposed to throw away the jug. It says very clearly that you're not supposed to recycle it or use it for anything else. So the purpose of this test was to check for types of kidney stones, like if there are remnants of different types of kidney stones, and they checked for a ton of different types. And I was found to have one type. So I did that. And then I did a CT abdomen and pelvis. And that is to look at the kidneys and to see if there's like hydronephrosis, what the kidneys are looking like. And because at one point, my temp went up to 100.1, I think. And I was having more severe pain, but then it went away. So I didn't go into the urgent care for that one. I had the CT and it didn't really show anything. It just showed that from my CAT scan in 2021, I had kidney stones in both kidneys. And then this one that I just had, I only had a kidney stone in one kidney. So it could be kidney stone. I don't really know. But the whole point of this is that I've never had any issue. When I was an ER nurse, I did have one kidney stone one time. And I think it was just because I wasn't drinking or peeing enough because I was doing 12-hour shifts. And if you're an ER nurse, you know what that means. You're just like on your feet the whole time. And I think I just wasn't keeping myself hydrated and peeing enough. Besides that, I've never had any urinary issues. So I'm just kind of like, is this a new thing? Is this a new long COVID present that I ever experienced before, but now it's going to be a part of my life? I can't remember if I already said this or not, because like I said, this is the second recording because my first recording got interrupted. I had noticed that there was some bladder, like it wasn't emptying quickly. Like there's some delayed emptying and like I would go to the bathroom and then there would be a pause and then I would like try to push out more and then it would be like another stream, so that it's something that seems pretty common with long COVID is to have issues with emptying your bladder that's because long COVID affects or can affect one of the nerves that causes the bladder to empty. So I decided to just take cranberry supplements just for 2 weeks. And it seems like things have gotten better. I don't have the pain in my abdomen anymore. And I don't have frequency and urgency, but I do still have a feeling of delayed emptying of the bladder, just a little bit, nothing crazy. But I do have a consult coming up with urology. And part of me wants to cancel it, but I think just because of the feeling like the delayed emptying and just to see if there's anything else going on or if they think that I should be doing anything else. I'm pretty sure it'll be a very non-exciting consult, but I still kind of want to know what they think. So I think that's everything about the urinary. But I just wanted to know what sort of symptoms you've had, if you've had any urinary symptoms, and if it seems to present as blood in the urine or urinary tract infections or abdominal pain, or if your bladder is also emptying slowly, it feels like, or if you're having urinary frequency or urgency. Any of those things I would love to know. I don't remember if I already said this, but the urinary stone, like the jug with all the pee in it, that test showed that there was one type of kidney stone remnant in my pee, but I don't know like how significant of a finding that is, because I haven't heard from my PCP yet. I don't think it's going to change my treatment plan at all. So I think that's all with the urinary symptoms. If anything comes from the urology consult, I'll be sure to do an update. I don't anticipate that it'll be very exciting. It's not for another month or so. But if symptoms get worse or anything happens, I'll be sure to post an update. So anyway, so that's everything I have with the weight management updates and the urinary symptom updates. Please feel free to reach out. I love hearing from you. If you have time, can you please write a review or share with other people that you know with long COVID? Thank you for listening, and we will talk again really soon. Okay, take care.